One of the questions we have from our audience is, what are the current obstacles preventing the formation of a regulatory college? If it is so important, what's prevented it from happening up to this point?
Michael, perhaps I can jump in there and start off that discussion and then let everybody else respond. We can only surmise what some of the challenges and what some of the barriers are towards the regulatory college moving ahead. We feel we've made a very effective case for the need for a regulatory college and the support out there for a regulatory college. That support has been growing exponentially over the last couple of years, not only from within our profession, but also from people like pathologists or radiologists and the medical profession itself. So there is significant support in British Columbia for moving it forward. And quite frankly, we're not really too sure why government is so hesitant. We don't believe there's a willingness on behalf of some bureaucrats in Victoria to really take this issue seriously for whatever reason. We're not too sure why. We believe that there's a belief out there that technologists operate under the constant supervision of doctors and therefore don't need to be licensed themselves, and we all know that that's not necessarily the case. We understand there's a belief that perhaps mandatory continuing education will cost the healthcare system more, and we don't necessarily think that is the case either. And there's also a belief, I believe, among some of the bureaucrats in Victoria that the responsibility, it's a responsibility of the employer to ensure that technologists are adequately trained and competent. And we know that with the rising costs of the healthcare system, there is insufficient funding out there within the system to ensure that continuing education becomes a priority within the system itself. So we also feel that's not really a logical reason to oppose the college. So we are right now trying to identify what some of those barriers really are behind the scenes, and then try and identify ways of addressing some of those barriers and moving forward with this initiative. And I think we're getting there. We had an excellent meeting this past weekend with representatives of all the organizations, and I think we will identify what some of those barriers are and then give everybody good reason to be supportive of pursuing a regulatory college for technologists in British Columbia.
I'll just add to Malcolm's comments. I agree with them all. I think government sometimes wants to see proof positive of the risk of harm, and sometimes it's difficult to illustrate that short of somebody getting hurt or worse. So it has been a challenge with respect to dealing with Victoria to show them that the potential is there for risk of harm from the various practices and procedures performed by this range of medical technologists. Also, we've tried to bring to bear to the argument that the majority of provinces, and in the case of the lab technologists, 9 out of 10 provinces have already regulated these professionals. So what is standing in the way from BC's point of view? I know that some of the bureaucrats in Victoria have issues with a college. They've had problems with other colleges, and some of them are loath to create yet more colleges. I don't know that we're stuck on what you call the regulatory mechanism, as long as it regulates the professions and provides for mandatory continuing education and other regulatory provisions. If you want to call it a law society, as the legal community is regulated by a law society. If you want to call it a council, as the teachers are now regulated by a teachers' council, really what you call it is quite immaterial. It's what it does that's really important.